Hi everyone, welcome to join our today's webinar. I'm Joy from HeyGen, and this is our live customer interview. And we want to discover some real customer story. And today we are very glad to invite Dr. Anja, the senior researcher from the University of Zurich, to join us to share how she's using HeyGen Video Translation to localize her research project into different languages. And we also want to discover like how AI can help for higher education. And this is like a live interview. And after we ask all our prepared questions, we will also leave some time for live Q&A. So please feel free to leave your question in our live chat, and we will cover it at the end of our webinar. So first, Dr. Anya, do you want to have a self-introduction to let our community know more about you?
Yeah, thanks a lot, Joy, for the invitation. And I'm really happy to be here and to meet you all. First of all, English is not my first language, so I apologize for any mistakes or missing words that I have. So I'm working at the University of Zurich, as you told. This is Switzerland's largest university. My background is social and health psychology and epidemiology. And so, generally spoken, in epidemiology, we study patterns of causes and impacts of health and diseases across diverse populations. And it's for me, it's funny because I'm involved into epidemiology for many years, but since COVID-19, everybody knows the word, before not. But mainly, I'm not involved in projects with infectious diseases. I'm more involved in projects with non-communicable diseases. This means chronic disease epidemiology that target, for example, cancer patients, persons with diabetes, lung diseases, mental illnesses, and so on. And basically, in my work with our team, we develop and conduct research projects in the area of health behavior change, physical activity, mental and physical health. And we especially, me at least especially, target patients with chronic lung diseases and also older persons, but also persons from the general population. And one topic is that we develop interventions. Those can be a community-based intervention, for example, to bring older people to walk more, but also patient-centered interventions that we want to adapt, for example, cancer survivors to a better lifestyle, or CPD patient programs. So we develop those interventions and we also evaluate them. And one major thing is that we want to implement them for the long term. So we are really focused not only to conduct research and to publish, but we also want to translate our research findings into everyday medical and public health practice and also to policy. So I also involved in measurement methods, mainly physical activity, digital mobility outcomes, patient-reported outcomes, and in large-scale population-based studies. We are currently conducting a mental health survey in Ukraine, for example. Yes, and I also do teaching, not much, but I'm doing teaching for medical students and epidemiological students.
Well, thanks for all this context, because we already work with your university, I think, for almost like 1 year, because we just renew for the second year. So it's really glad to hear like you can use AI to help for your research project and also your teaching. And it's also interesting because I'm not a native speaker, so sometimes I feel like language is a barrier when I want to communicate with our like customer audience from like different countries. But I think it's also related to today's topic, like how we can use AI to translate and to translate your research project into different languages, and that more audience can be available to that meaningful content for health education. I think that is a really great impact. So I know the specific project you translate is called HOMEX. So would you like to introduce a little bit more about HOMEX, because I think that is a new concept for many of our audience.
Yeah, this for us it was an interesting development. Actually, we started with HOMEX I think 8 years ago. The background is that we do a lot of research with people with COPD. This is a chronic lung disease, and those people should actually move because otherwise the health status gets worse. And usually they have a lot of dyspnea. And so it's quite frightening for them. So they avoid moving and physical activity. And so their health status gets worse and worse. And we know that those patients often go to rehabilitation, and there they train and they feel better. Then they go home and stop training. And this was our starting point, that our interdisciplinary team wanted to develop an intervention for these patients, that they can conduct strength training at home alone. And we developed 12 exercises with different difficulty level. And we actually first we talked to the patients, and we decided at the beginning that we wanted to deliver the intervention analogous, not digitally. So we printed the exercises in colorful cards, and the idea was that the participants or the patients conduct every day, not long, but 15 to 20 minutes strength exercises at home with minimal equipment. They only needed a chair and elastic bands. And we wanted to bring this exercise into their habits in the usual day. And then we got funding. It was quite great, and we could conduct a randomized control trial. So we conducted this study for a year, and we compared patients who conducted the exercises at home to patients who did not, and we could show that actually they indeed improved in exercise capacity. But for us, more important was that those are really old persons, and usually they have multiple diseases, and that they trained at all. This was really great. Of course, often they had events and couldn't train. So summarized, it was something we quite liked. And then COVID came, COVID pandemic, and we thought that actually a lot of people are at home, and it would be really nice to have an online version of HOMEX. So during the pandemic, then we developed together with a graphic designer and with a film team, on the one hand, a website where we included all the content of the exercises, and on the other hand, we developed the videos. We filmed all the exercises, and in total we had 48 videos. And yeah, this was then the point. We thought, because we wanted to target our group and not only COPD patients, but also we thought the exercises are for older adults. Good, that those are easy exercises which can be conducted by them. But since we wanted to talk with the patient language, we filmed the videos in Swiss German. Here in Switzerland, we speak German, but we speak a dialect. And German people who speak German, such as in Germany and Austria, they don't understand us. The written language is German, High German, but the videos were in Swiss German. And so, which brings us together. This was actually then the starting point, that we had this website in German, but the videos were in Swiss German, and only Swiss people could understand them. And then we got in contact with our web designer and with the film team, and we discussed with them. We had all the text, actually. This was not the problem, but we discussed with them how we can translate the videos in other languages. And it should have been, we are researchers, and we always have really low budget, and it just wouldn't have been possible to translate it into other languages. And yeah, this is how we
Get started.
We had the idea to work with AI.
Oh, that's amazing story. Especially, I think this project sounds like starting with a small, like specific special group, and to a broader audience, and also related like COVID, that people can just in home. And I have watched some of video. It's very nice, and I also think like everyone can follow that video to do some home exercise at their own home or office. And also I see that course is very like visual appealing and have visualized. And Dr. Anja, do you want to just directly share your screen and show us the home's like web page and some video project you translated by AI? I think it will be very visualized and give us a direct sense about your project.
Yeah, I try to share my screen. Just a moment. Can you see my shared screen?
Yes, we can see the HOMEX page. Yeah.
This is actually the HOMEX web page. This is I just show you the original Swiss German homepage website. We started with that, and you better understand English, so I switch again. What we wanted to do, the videos alone were not enough. We had this whole program, and we wanted to bring the structure into the website. So on the one hand, we have this website. I just really quickly guide you through it. You can have a look at it after this webinar, but just maybe this is also interesting for you. We have here background information about the training with a lot of details, how the training is structured, and then what it actually is that we have 3 body parts that are trained each at 2 days. So actually, if you use the program, it's meant that you train for 6 days a week, and you can choose between easy, medium, and hard exercises, and also how many exercises you want to do, and you can switch around. So yeah, and always. As I told you, on 2 days, there are specific body parts that are trained. And now I chose the level and the number of exercises. And then it's really easy. If you want to start the training, I first show you the weekly plan. Here you see that on Monday, Tuesday, Wednesday, the core, legs, and arms are trained. And the same Thursday, Friday, Saturday. And now we have Thursday. So actually today you train the core. And based on the pre-settings you did, the website is just showing one video after the other. Those are this is the warming up, this is the stretching exercise, and those are the 3 strength exercises. And then you just can training today, and then you have it shows you one video after the other. I first want to show you regarding the translation, which I think is really interesting. Maybe it's nicest to see we have 3 frontal videos where the physiotherapist speaks directly to the audience. And as you can see, I show you first the original one. This is the Swiss German version.
It seems cannot hear the sound this time.
Oh, you cannot hear the sound this time, yeah.
Yeah.
Yeah, maybe you can quickly.
I can share my screen. I can share my screen.
Okay, we have some problems with.
Yes, no problem.
Mm-hmm.
Can you see my screen now? Yes. So I think this is the original video, right?
This is the original, yeah.
Grüezi. Schön, dass Sie sich Zeit nehmen, unser HOMEX-Trainingsprogramm anzuschauen. Das Programm hat ein Expertenteam von der Universität Zürich, speziell für Menschen 5.
Just that you have now you have an impression of her voice, and what HeyGen did, you have the choice between using the original voice of her or using an artificial voice. And we translated the video program, the 48 videos so far in 4 languages. And for 2 languages, we used her original voice, and for 2 languages you use an artificial voice. Maybe you best show Joy first the English version. There is the original voice, and it's really surprising how similar it's actually her voice in English.
Yeah, and this is a small tag translated with AI.
Hello, I'm really happy that you're taking a moment to look at our HOMEX training program. This program was developed by an expert team from the University of Zurich, specifically for people.
We have it in Italian. We have Czech, Italian, and High German. Maybe an artificial voice is Italian. Just you choose Italian. This is an artificial voice. Yeah.
Oh, this is artificial voice, AI
Yes,
voice.
this is artificial voice. Yeah.
Ciao, sono davvero felice che tu stia qui per guardare il nostro programma di allenamento HOMEX. Questo programma è stato sviluppato da un team di esperti dell'Università di Zurigo.
Yeah, thank you. So it was funny because we had the English translation. We had a student who did it, who is bilingual, German and English, and he best liked actually her original voice, and he thought that the others were a little bit, he didn't like them so much. But the Italian translation was done by an Italian bilingue student who speaks German and Italian, and he liked the artificial voice more. Yeah. So, but you can choose between different kind of voices. Yeah.
That's
and
great.
For us, it was really important that she's really motivating and nice in Swiss German, and so it was really important that it's the same impression in the other languages as well. Yeah.
That's right. So it sounds like your workflow is your students like they help to doing the proofread processing and review the script.
Yeah. The point is for us, again, we have really limited budget and we couldn't pay people to do the translations. Should I quickly guide through explain how the workflow worked?
That would be helpful.
Actually, we started with these videos. We had our graphic designer had the idea about artificial intelligence translation. I didn't know that, and he showed us a few companies who did it, and we thought actually that HeyGen had the best quality. And then when we had the contact and we started with the translation, the workflow is that we have those original Swiss German videos, and I was surprised that actually the system understood it. It's not a really common language, but we first translated the videos into English, and our student really diligently went through each text passage. Not only, of course, it's really important that it's correct, and it's also important that the length of the talking is the same.
Yes.
So this is actually how we did it, and we always had, because we couldn't pay anything, we always had actually students and people who work here in our institute who are bilingual. So this is why, for example, we have the Czech translation. We did it. So I don't know, Joyce, should I share my screen again and show how it looks like for the translation?
Yeah, that would be helpful. I just stop sharing and you can share the screen.
So I have to tell you at the beginning, I didn't do the translations. I only supervised the persons who did, but our students are really well educated and they are used to use software. So it really was actually self-explaining. And I just want to show you how the process usually went. We have, as I told, we have those 48 videos, but they are not long, maybe 2 to 5 minutes. We have 3 face videos and others are training videos. And you start now we all translated in English. Those are now our videos we use for other translations, because English is the language that is most or better known than Swiss German. But you actually start, if you want to translate a video, that create a video translation, then you can upload a video and then create proofread, because if you choose create new translation, it's just translated, but proofread, you can change the text, which is for us very important.
Yes.
I just show you a video that we already have translated by AI. This is one in Spanish. And if you just upload the video, you choose the language that you want, and then you have it here as this example here. In Spanish, we are currently translating the program in Spanish. And then, as you can see here are the text slots she taught. And here are the automatic translation by the system. And you have now this video, I don't know how long it is, but you have here all the text passages. And that's what actually our task is, and the task of the student should be is, on the one hand, control whether the content is correct, which is actually important in our context, because it's a physiological program. And on the other hand, also that it's not too long or too short. And then you can a little bit play around. I think I try again, but I think I can't. You won't hear my sound, but I try.
Yes, we cannot hear the sound, but
you cannot hear the sound, yeah.
Yeah, but we can. Preview.
Yeah, what is interesting, what you can. I don't find it now, but it's really interesting because you can choose between the different artificial voices or her original, as we did for English, for example, which is translated. So you can hear change the text, and what the students also learned, because I suppose it's developing your software, and it also because we wanted to make it really motivating. We sometimes played around with exclamation marks, and that changed a little bit the sound of everything. So yeah.
Oh, it's great. I think the feature you mentioned can select the voice is like the speaker one. There is a voice like track one. You can switch the voice. You can use the original voice from the original video, the speaker's voice, or you can use HeyGen preset public voice. So you can use AI voice. And it's also glad to hear like the students in this free process, they play around the two and also learn from this experience. Yeah. And I'm curious about when your students translate these videos, because I know for some training course is also have some like body movement. It's not just the like front face speaking. It's also includes some training instructions. What is the most like challenge part when you use AI to translate this type of video?
Yeah, I think the quality of the lip sync is, of course, much better if the person speaks directly into the video, because it's much easier. Sometimes when she trains and her face is like that, it's not perfectly, but on the other hand, actually, it's small and it doesn't matter a lot. For us, the most challenging thing was to keep the quality of the voice at the same level, and also the sound of the voice, and also the motivation that it just keeps on the same level. But we also noticed during the time we started with that it got more stable, and for example, I can hear some differences between English accents, but not so I'm not so sensitive to those, but I'm very sensitive to High German accents. And in High German, it was interesting that sometimes the system translated it with an Austrian accent and sometimes with a German accent. And so sometimes you can choose between accents, but those we couldn't, but we just thought maybe the system was just feeded with those maybe with those speech examples. But as we thought for us, yeah, those was one challenge, and we thought now maybe we will redo because the system got more stable. Maybe the English videos again. We will check just to make it more as the same. So we were quite happy with the result, but maybe to make it more stable, we will redo that. Yeah, but the first translation into English was effortful because the student really noted all the time stamps which are necessary, but now the translation to other languages is much easier because we have those exact time stamps. So this was great. And for me, because I'm the supervisor and I wasn't always up to date, for me actually it was always quite self-explaining when I was together with somebody who was trained to do a new language.
Yeah. This is really great feedback, especially for this accent. I think when we demo that proofread workflow in the first step, there is a drop-down list for each specific language. You can choose that accent in your proofread process. And also, if you have like more like accent feedback, even like our audience have the accent feedback, please feel free to directly connect with like HeyGen team. We have a dedicated AI researcher team. I think it will be really helpful. Like we can gather the feedback, especially from the native speaker. It's also like help us to understand which part is missing, and we can improve our backend technology.
This was also one reason why we choose for Italian and Czech the artificial voice, because it was more stable. It was clear from the beginning, yeah.
Yeah.
But as you say, this as well, I think only the native, even if I understand French and Italian a bit, but not good enough to judge whether it sounds nicely or not. And I think, as you told before, it's really interesting. It's all about languages, right? And you are really sensitive in your own language and less in others. Yeah.
That's correct. I'm also curious about when you, because I know HOMEX website is public, like everyone can directly like choose the class and learn the content. What is like the audience feedback for this AI translated video? What is their feeling, like their feedback directly to this kind of course?
Yeah. Just for your understanding, we went live with the Swiss German version in 2020. And when we had the idea to translate it into other languages, it was on the one hand because WHO contacted us. We are a WHO collaborating center, and they were really interested in promoting strength exercises to older adults. So, then we started, and we introduced the multilingual website homepage only a few months ago. So I have feedback from the Swiss German version, and it's actually quite good. They are quite happy, and I don't have any feedback so far from the other languages. We also we will go again through all the videos because they have been that everything is correct, and we are now planning on the one hand with WHO to they also will then promote the program. We haven't promoted it so far in the large scale, but we will, and I can provide then more feedback to you then. But we are planning with them, with WHO, to translate it in other languages as well. And we are also working together with our department here at the Institute of Prevention and Health Promotion. And for them, they are now planning to promote the program in Switzerland in different regions. And we want to translate it on the one hand also in French. This is a language of our country, and also to languages we have a lot of people here in the country, as you in the US, who are not born here and who have a migration background. And we want to translate it into the most spoken languages, such as Spanish, for example, Portuguese, Serbo-Croatian, Albanian, Turkish. And this is planned here. And I'm convinced that we will have feedback on those, also because the Department of Prevention and Health Promotion plans to implement, to make information that this exists. So I know then more feedback.
I really appreciate you share all this information. It sounds like this good content will be promoted in the coming months. And also, I think it's for HeyGen, like now, the video translation, you can translate into 75 different languages, 170 different languages. So it's include all like common language accent. So it's great now. I think because we have that unlimited plan, so you can directly translate into more and more languages.
I just shared the address of the website, and just for your information again, the Swiss German version is really of high quality, and the other translation should as well, but we never checked all the videos, so there might be some mistakes still, but we will double check it in a second step. So
yeah, I think Chrissy, my colleague, can share this link into our community, and people can get access of the website.
Yeah, and it's just again for your understanding, it's really exercises for older persons. We say persons above 65, and we had a lot of. We check that they are safe, the exercises, and we know that they are safe, and we know that they are effective. But for younger persons, they are too boring. But it's really for older persons that they can safely do strength training at home. So if you have, maybe my mother also uses it, if you have parents or relatives, just you can share the address with them. It's for free and you don't have to register, you just can use it.
I think we can forward to our family, parents, grandparents, and they can consume this content. It's really helpful. And also, Dr. Anja, I'm curious because you're like a senior researcher from university, and now I think we already verify like we can use AI to translate your research result, your project, and this kind of e-learning training content into different languages. I'm curious about have you ever think about like for the other AI feature, like AI generated video or video avatar or interactive avatar, this kind of technology can help or enable your research project or your future like teaching, because you also mentioned like you're teaching the student in the university.
Yeah, well, I think this is something which is definitely an option, which will come anyway. And I think myself, I haven't used it so far. If we use videos for onboarding or so, we usually ask real patients or professionals to do that, also in patient education programs. But actually, I can imagine that this is of course a solution, and so I'm involved in patient education programs and also in those apps I told you. I think this of course can be a solution. For us, it was because we are a bilingual country and we have a lot of people who speak different languages. It might still be the language, or the possibility to translate in other language might be still the most use we have. And for teaching, for that question, could be an option. But I haven't tried myself so far the avatar option. But what actually we did once, we did a motivational interviewing coaching program. But this was years back, and then my colleague used really simple software, and I'm quite convinced that something like that would be be a possibility that you can train talking, counseling skills with AI, I would say.
Yeah, I think that sounds like an interesting use case. Because when I think about use case, like for example, now you're translate this kind of existing content, training content. But for example, in the future, you have some new project, you probably can use this kind of avatar and to create the net new training content or e-learning content. But just still like some other like use case when you can use AI for e-learning and education. And I think it seems like we have some questions from our audience. I can directly ask you for some questions really from our community.
Yeah, I can see it. Do you plan a study to evaluate lip sync on all languages existing at the Uni Zurich and use online lectures? No, actually not, because our intervention is really just targeted to all the people who use the website, and we didn't have resources now to assess the quality. But what we want to, what I actually am planning, that we have to use the resources we have with the students and with my international colleagues, that we can translate them into as many languages as possible. But so far we didn't plan to use online lectures or so. We more plan to promote the website to all the people, and also over communities and rehabilitation centers. Yeah, and WHO will definitely promote it as well. Yeah.
That's great. And I have a follow-up question related to HOMEX project. What is your for example, your goal for the next 12 months? Do you have some specific language list or your goal for this project?
Yeah, this is a good question. I'm really happy. We have a colleague who speaks Spanish and Catalan, and she will now translate it into Spanish and Catalan. It's, of course, the videos, it's also the website text, but this is also translated by AI and corrected by a native speaker. And as I told you, we are hoping for funding from the prevention department, so that we will translate it to the most spoken languages here. And we try to collaborate here as well with colleagues from the French part of Switzerland, or people who were born here, students as well, students who speak Albanian or Serbo-Croatian or Portuguese, and we will pay them. When they come, of course, students who just come to translate it and who don't work in our institute, we will pay them hourly for the translation work. Yeah, so this is those are the most my wish language is French, of course. Yeah.
Sounds amazing. Yeah, and also I think our webinar is already like 40 minutes. So Dr. Anja, I think at the end, do you have some final thoughts or messages you want to share with the HeyGen audience? I think who participate this webinar, most of them probably also come from education background or e-learning background. Do you have some final thoughts you want to share with our HeyGen community?
Yeah, maybe for me personally, I'm so involved in so many projects and I have so little time, and it was really a great opportunity because we did all this work, and yeah, it was really a great opportunity to make this program somehow sustainable. I'm still, my challenge is how we can keep the quality of the translations if we don't have the budget, such as private companies who have specialists who do everything. So we try to do a good mix between being pragmatic and reaching a huge audience. But for me, it's really exciting also being part of this development, because years ago this wouldn't have been possible at all. And when we first translated, she's called Ramona, the person who speaks and who trains in the video. I worked with her, and she really went in the study to the patient's home, and I worked with her. And when we first had the translation of her voice into other languages, it was really strange a bit, because it was her voice and it was her lips, and but she spoke perfectly all of a sudden English and so on. And this was also something I was really happy that she was willing, that we were allowed to translate her into these languages. This is why we also we report on the website that it's AI translated. Yeah. So for me, it was really quite amazing that it was possible, because we couldn't have paid the translations if we have to do that manually, and that it was possible to do them like that. So, yeah.
Yeah, thank you so much. And also for me, like for HeyGen, we also appreciate your, like, because this is already like your second year using HeyGen. You already verify like this kind of use case, and you also want to share your experience, your workflow to our community. We really appreciate your time, and you prepared all your presentation and share with our audience. And we do think like HeyGen can help for education, like for different kind of use case, from avatar, from video translation, from interactive avatar. And we also want work with more and more educators, universities, schools, to see how HeyGen can bring this kind of positive social impact. So we do appreciate your time today, and thanks for joining us. And this is our like Thursday webinar, so we will be doing it bi-weekly, weekly. So every Thursday, like our community will have this kind of live events, and hope our customer can join us for our next week events. And our like upcoming events will be posted on our HeyGen hubs, our community, and we are looking forward to seeing you next time. And thanks again, Dr. Anja.
Okay, thank you.
Yes, thank you.